The 2019 consensus document on arrhythmogenic cardiomyopathy is extremely important because it defines a new disease. It defines arrhythmogenic cardiomyopathy as a twitchy heart, as a patient who presents predominantly with an arrhythmia or symptoms related to an arrhythmia and has structural heart disease, not due to ischemic, hypertensive, or valvular disease, as a patient with an arrhythmogenic cardiomyopathy. This document tells us that this broad group of patients need to be carefully evaluated. They need to undergo risk stratification, very often a careful family history and genetic testing, because many of these patients will have a specific condition that needs specific treatment and very detailed management. The goal of the new consensus document on arrhythmogenic cardiomyopathy is to draw attention to patients who present predominantly with arrhythmias who have cardiac dysfunction. These patients should be now referred to as an arrhythmogenic cardiomyopathy. The differential diagnosis is then extremely broad and can include sarcoidosis, myocarditis, ARVC. So there's many things that can be eventually diagnosed, but all these patients need careful evaluation. They need a careful family history. Many will need genetic testing, cardiac MRIs, and so forth, so that a specific diagnosis can finally be made and proper treatment prescribed. An EP should read these guidelines because these are patients that are presenting to electrophysiologists for evaluation. And you only will diagnose what you know. And this document is very important because it goes over many conditions which the average electrophysiologist does not think about every day, but are extremely important and are diseases that should not be missed.